One of the other common problems that we encounter is what we would often refer to as ovulatory dysfunction. It's a lady who is not ovulating. And one of the most common causes for that would be polycystic ovarian syndrome. The term polycystic ovarian syndrome gets its name from an appearance on ultrasound scan of the ovaries, where there tends to be tiny little cysts along the edge of the ovary. Typically we find that these patients would have 3 or 4, maybe 5 periods a year, which would often signify that they're not ovulating regularly. It involves a number of hormonal investigations and more detailed, often an internal ultrasound scan as well. Once we get these and we've made the problem with getting them to ovulate, and it revolves around polycystic ovaries. By the way, there are many other causes for not ovulating. By far the most common would be polycystic ovaries, but once we make that diagnosis, we tend to do very well if they're relatively young with a form of treatment that's referred to as ovulation induction, where we basically make the ovaries ovulate instead of just remaining silent and quiet. And we use a number of hormones, either in tablet form or maybe an injection, depending on what the patient would need, and actually get them to ovulate and try and time the access of sperms by intercourse or an insemination appropriately timed. So a lot of these patients would actually achieve their pregnancy in a relatively simple form of fertility treatment, not necessarily having to go to things like IVF. Extremely satisfying. Again, a lot of lifestyle factors play an important role in possible endometriosis. There is a strong association with weight, particularly in some of the women who might be overweight, which would tip them from being just normal ovulatory cycles into polycystic ovaries. And often I'd get a history saying that, oh, I used to have regular periods, one every month, and then, I just got on with life and became a bit of a couch potato, and I piled on the weight, and I noticed that my periods started to go sort of maybe 6 weeks apart and then 8 weeks apart as the weight piled on. And often I tell them, you don't need me to explain how to treat yourself. You just need to take the weight off, and you'll find your periods will slowly go from 8 weeks to 6 weeks to 4 weeks, and you'll ovulate. But these are all lifestyle issues, often difficult. And there are also a number of women who will say, ever since my periods started, I noticed that they were irregular and I had issues. They would always be 6 to 8 weeks apart or more. And they would probably be a slightly different group. They need not necessarily be overweight. That's just one of the problems that they inherently were born with or have been suffering from a very early stage since puberty, which is probably a slightly different kind of polycystic ovary to those that are weight-related, which is often at a much older age. But this is another important group that we actually deal with.